I would also like to welcome Sharon. Sharon Vitti is with CVS Health and Minute Clinics, and she's going to have a seat with us and talk to us a little bit about what they're doing now in the Minute Clinic space. She is the Senior Vice President of CVS Health over the Minute Clinic book of business. Sharon.
Morning.
Welcome. Thank you for coming.
Thank you for having me.
It was kind of a last-minute thing. Troy Brennan, the Chief Clinical Officer for CVS Health, was intended to be here, but he had to do a little thing like testify in Washington, D.C., and I don't know how that trumped this event, but nonetheless, Sharon was gracious enough to come.
I think I got the better deal here.
I think so too. I absolutely think you got the better deal. So thank you. Why don't you maybe tell us a little bit about yourself, your role, and how you got to be where you are right now.
Sure. So good morning, everyone. Delighted to be here. So I lead Minute Clinics. I'm the president of Minute Clinic, and I've been in this role for about 5 years. But prior to that, I've kind of had this pretty, sort of traditional path. I knew I wanted to be in healthcare my whole career. And I got into undergrad school, and I had that why that everyone has. Do I go provider? Do I go administrative? And really wanted to impact healthcare on a much broader level. So I went the path of being an administrator and worked in lots of provider organizations, and probably really on the front lines, getting to know the challenges and really the pains for patients. And so through that, moved into a national consulting practice because I wanted to see how this manifested itself across the country in different communities and different geographies. And so did that for about a decade and really enjoyed that, got a lot out of that. And then kind of gravitated back to provider and worked in an academic integrated delivery system for another 10 years in Boston at the Brigham and Women's. And that was really, I worked to forge a role, a portfolio, and a strategy in ambulatory care. They really didn't have that as a strategic area. So enjoyed doing that and oversaw their women's health also. And then I moved to Minute Clinic and to CVS Health. And it kind of brought all of those things together for me. So it's a national practice. Minute Clinic, we have over 1,100 clinics across 33 states, including the District of Columbia. And so we deal with all different communities and different healthcare needs that vary across the country. It's ambulatory care and it's retail care. It's kind of pushing that envelope in the ambulatory care continuum to create more options for patients. It's very focused on moving forward and innovating in a disruptive way. And so that was kind of putting my traditional background together with basically a startup in retail healthcare.
Wonderful. Now, CVS has been redefining itself lately with a small merger that occurred with Aetna Healthcare. So tell us what that journey has been like, and what does that mean for now CVS Health writ large?
Yeah. So CVS Health has been doing a lot through its time as an organization, a lot of mergers and acquisitions. CVS Health has grown their retail footprint to over 10,000 pharmacies and front stores, basically through acquiring different pharmacy chains. And so that was a growth strategy. They've also acquired many adjacent types of businesses. So Caremark was a big acquisition for them. There are others. Quorum is a home infusion program. Minute Clinic, the provider space. Omnicare, which is kind of pharmacy within long-term care setting and a SNF setting. So CVS Health has, and then we took the clinics and the pharmacies from Target in 2015. So this is a company that I've learned through this. I haven't been through all of these. That really has part of their strategy of growth to acquire and to merge. And so what they've done is they've created a muscle in being able to do that. Now that said, Aetna is a much bigger acquisition than we've ever done before. And it's vertical, right? So it's just a whole different business, if you will. And so, it creates a tremendous amount of opportunities. There's so many assets in Aetna from the, health insurance space, both the assets, the focus on the members and their customers, and then there's just a lot of talented people. And you take that and you bring that into CVS Health, and we're just finding so many new opportunities to put 2 and 2 together and create 5 or 6. And so that's really been the most exciting. I mean, it hasn't even been a year. This all happened in right after Thanksgiving of last year. And so, we're still in the sort of courting, honeymoon phase. But I think that the potential is here to really bring together the assets focused on the patient, the consumer, the member, and to really be impactful in the overall healthcare landscape.
Now, combined strength is about 250,000 employees, is that right? Somewhere around that size, so that's enormous.
Yep.
And so one question I have is, so moving forward, are you to become a payer that has a provider portion of what you do? Are you a provider with a payer side, or is it somehow something that's different and fully synergistic?
Yeah. So we have, large enterprise. We do have a health services group, right? So that's our insurance kind of group, which is both our PBM and our health insurance. We do have a retail. I mean, we can't move away from that. That's our bricks and mortar. We have a very robust pharmacy business, and then we have a lot of other smaller businesses like the Minute clinics, et cetera. And I think the vision is, to move away from those core businesses and to put them together to be something that is bigger and more disruptive in healthcare. And so we have the tools to do something different. And I think that's, Larry Merlo, our CEO, that's what he talks about. How do we take these assets that we have and really have an impact on the health of our members, of our patients, of our customers, doing it in a way where we're leading, and we're doing it in a way where we're improving health outcomes and decreasing the cost of care.
Now, that latest something different and new, I think you call health hubs. Why don't you tell us a bit about health hubs, what that's about, what you see the vision for that as you move forward?
Yeah. So the one thing I should say, Adam, is that we are creating an ecosystem by putting together our assets and leveraging those relationships that we have. But there's none of us at CVS Health that see this as a bubble. This is in concert with or in collaboration with traditional healthcare, with large employers, with other health plans. And so that's the interesting piece. So the hubs are an example. And the hubs are a part of our more forward-thinking strategy to become more involved in healthcare. And it started back when CVS Health, a few things that you all may remember or not. CVS took cigarettes and tobacco out of our stores. That was 5 years ago. And so that was a statement to say we want to be in healthcare in a different way. We changed our name to CVS Health. That was a couple years later. And then I think this acquisition is just one more step in that journey. So the hubs are a strategy that tries to leverage what we have and move us deeper into healthcare. When we think about healthcare being local, and we think about CVS Health being local. We think about focusing in on the consumer, if you will, and how do you make things easy for them. And then we think about being impactful around both health outcomes and the cost of care. So the health hubs are a way of reusing or reframing our retail space. So, and what it is creating a community where a patient, a consumer, a customer can access different types of services. And it's just leveraging what we already have. So we're taking 25% of the front store, our store, right, and converting it into something that has more of a health orientation. And so that manifests itself in a few days. One, different products in the front store, things that are more focused on health and wellness, self-care. Secondarily, in the pharmacy, getting the pharmacists to come out from behind the bench and giving them the time to interact with patients. Patients or customers come into CVS Health and interact with their pharmacist frequently, more than once a month. We have over, just under 5 million people come into our CVS stores a day. So we've got the front store, we've got the pharmacy, the Minute clinics. All of our hubs have Minute clinics. And the Minute Clinics are expanding their scope of services. We're adding a leveraged provider, a lower level provider, and then we're expanding our space a little bit. We have a community room where people can come together and either have an education session, or they might have a little yoga class. So really for the community to come together. And then we have other services that help patients navigate. So for instance, we have a concierge. And that concierge doesn't even have to be a patient, it could be a customer. Someone coming into the store that has a need. How do we help them figure out what their, how we can help them with their need or connect them both within the store or outside of the hub.
How do you view that interacting with health systems or existing physician groups or what have you, other providers in the community where your hubs are? Is this meant to sort of supplant what they're doing or supplement what they're doing?
Yeah. No, so the latter. We call what we're doing, we call it complementary primary care. And so the services that we're curating, or the offerings, so for example, say DME. We have DME in these hubs in the front store. So DME is something that a provider could conceivably want to prescribe for their patient. They don't have DME in their office. So knowing that it's right down the road, easy place for patients to get it. So that would be an example. Another is within the Minute Clinics, we have an annual diabetic exam visit. Within that, we also have diabetic retinopathy. So again, is that a service that could be helpful for one, adherence, and then two, most physician practices don't have a diabetic retinopathy camera in their suites. So we're trying to develop services that either bridge gaps that aren't, that haven't been filled, that complement what an integrated delivery system or a provider would do. The other thing is really thinking about how, the patient journey. And so if they start at the hub, they will need services beyond the hub. The hub isn't the end all. And so how do we think about creating that relationship so that we can, with confidence, make it easy for the patient to get to that next level of care? Yep. So we see it as a bi-directional ecosystem where we couldn't do it by ourselves. We need to do it in collaboration with other providers, integrated delivery systems. And so if you just think about the patient and/or caregivers and what they need, how do you create that ecosystem to make it local, make it easy, make it affordable, and make it impactful?
So 250,000 employees, almost 5 million potential patients per day walking through their stores, an enormous player in the healthcare space, serving to completely disrupt how ambulatory care is being provided in many communities. Something indeed to watch, something to contemplate how we as others can work with and work for and work with in partnership with folks like CVS. And so thank you so much for your time. We really appreciate it.
Pleasure being here. Thank you.